Hello, Carrie Shannon here with quick tips for patient preparation in regards to blood pressure. Hopefully, you have already viewed my overall video on accurate blood pressure, and there's some important content that this goes with. So, this is in regard to patient prep. It's very important that we're assured that the patient comes in and is feeling relaxed. Usually, when patients come in, they've been rushing all day. They might be stressed about an outcome. They're not feeling well. So, we want to first and foremost welcome them in and help them get comfortable in the room. So, you want to make sure as you're preparing the patient that you check that the patient is comfortable. You want to visually look and make sure that their legs are not crossed. When you are taking the blood pressure, again, it's important that the arm is at heart level and supported. And you are going to be taking that blood pressure on a bare arm. Again, this goes with your company's protocol. So if they allow, tighter shirts underneath, that's fine. But according to our book, it's always taken on a bare arm. Then it's really imperative that you communicate the steps with your patient first. You don't want to assume that, oh, they've had their blood pressure taken a million times. I don't need to tell them what I'm doing. I don't need to get implied consent. I'm just going to take it and get it done. And a lot of times, the lack of that communication is very nerve wracking to our patients. So, we want to communicate that we'll be taking their vitals, that we're going to take their blood pressure. We like to ask permission to do that and talk them through the process as you're completing all of the vitals so that they know what to expect next. And then, if the patient appears to be stressed or rushed right off the bat when they come into the room and you're rooming them, give them a couple of minutes. Do something else first. Try to talk to them and calm them down. I even have had MAs that will go ahead and say, hey, let me turn off the lights here for a couple of minutes. You take some breaths. I'm going to go take care of something. Then it'll take about 3 minutes and I'll be back in. But just being aware of what their body language is telling you is very important. Once you take that blood pressure, if for some reason the reading seems to be abnormal, then you want to make sure that you retake that blood pressure, and you always want to wait at least 60 seconds in order to retake that blood pressure. So I hope these were helpful quick tips. Please feel free to reach out via email with any questions or comments at adventuresinlearning.info@gmail.com. And also make sure to subscribe below and leave me any notes there as well. I have a website, adventuresinlearninginfo.wordpress.com, that goes over information on my coaching and consulting. So you can also visit that website as well. I hope you have a great day and I will see you online. Bye bye.